Hello everyone, this is Dr. Bharat BNK, a general surgeon working at a government medical college and hospital, Raichur, Karnataka. This video is for my fellow Indians who are not part of healthcare profession. I hope by now we all are aware of the horrific turn of events that happened at Arjikar Medical College and Hospital, Kolkata. Just to brief, a 31-year female doctor who was a chest medicine resident on her duty day was raped and brutally murdered in the same hospital building, possibly by more than one person. After her duty, she went to rest at a seminar hall, which was in the third floor of the same hospital building. And in the morning, around 7:30 a.m., they found her body in a very, very pathetic state. A lifeless body, half naked, injuries all over her body, including the private parts. Pieces of glasses in the eyes, both her lower limbs turned perpendicular to her pelvic girdle, a broken collarbone. But what is more horrific than this is the incident did not happen in some goofy area. It happened right in the hospital where she was working, in the seminar hall of the hospital where she was working. But what is more horrific than this, what is more pathetic than this, is that we have turned deaf ears to it and we have become entirely cold to the incident. If this can happen in a hospital, this can happen anywhere in India, in any workplace of India. If this can happen to a doctor today, it can happen to any one of us tomorrow. Any one of the victim, maybe our kith and kin, our own blood relative, our cousins, our sisters, maybe our daughters. Such unfortunate incidents are happening and we have been entirely cold to the incident. Just because she is a doctor, it doesn't mean that it is only the medical fraternity who has to bear the burden of protesting against the incident. Even before becoming a doctor, she is a female child. She was a daughter to someone, she was a relative of someone, she was a cousin of someone, she was a friend of someone. And we have lost that soul. And in the entire nation of such a huge population, the only people who have been fighting for her, fighting for justice, demanding safety at the workplace has been only the medical fraternity. I kindly request all the public to join us in the fight. Because whenever there has been an emergency, be it a medical emergency, non-medical emergency, we all know about the COVID pandemic. Since times immemorial, whenever the nation has needed, the doctor community has rendered. We have rendered. We have been with you in wars. We have been with you in pandemics, in endemics, in any disease, any time, anywhere the nation needed us. We were there. We have rendered. We all know about the COVID and the lives lost of the healthcare professionals in the COVID, and yet we did not stop. We are serving. All we are asking is that basic safety and security for our own colleagues to work in the hospital. We are not denying work. We will work any time of the day, any time of the night, any time there is an emergency, and any time a service is needed. We are always there. But what we ask is that the government, we request the government that we be provided with a safe working environment. Just imagine if the seminar hall was not somewhere else, somewhere in the third floor of the hospital, if it was just beside the casualty. Because casualty, there are a lot of patients coming, a lot of other department doctors are there, nursing staff are there, people are there. If the resting room with basic amenities was there just beside the casualty, maybe shouldn't have gone to the third floor. If the CCTV surveillance was active, not that retrospectively we analyzed and we found that some person was entering there at 3 a.m. or 4 a.m. If just in case, if there was a security person who was sitting right in front of the CCTV and monitoring and saw that person entering there on the TV, then if he had alerted, maybe should have been alive now. If the security guard was little more careful, he allowed only the people with ID cards, with specific ID cards into the hospital, the perpetrator wouldn't have dared to commit this. Just like alarm buttons everywhere, if the hospital had a panic button in every floor, just in case, if there was a panic button, the seminar hall should have fought her life to press that panic button and someone would have ran for help. When there's an emergency to the patient in premium hospitals, we have code greens and code reds, code blues and code reds, and when we activate them, the entire hospital comes to know that in so and so ward, so and so patient needs emergency care. Why can't we develop a system to send SOS messages to the residents? All this is not rocket science. Everything is achievable, everything is possible. But for that to happen, we need the implementation of laws. All we are asking is that the justice be served to the way, and to prevent such acts from being committed in future. The bare minimum requirement, the safety and security, at least for women at the workplace, because we all know every time there has been assault on any doctor in any part of the country, it's just the medical fraternity which comes down to the streets. We protest, and after a long waiting period of time, we get some assurance from the government, and they ask us to call off the strike. In the hope that something changes, we call off the strike. But we wait and wait and wait. All of them are just on paper, nothing gets implemented. And in a matter of months, the same incident happens somewhere else in the body, and this becomes a vicious cycle. And we are just in the center of the cycle, hoping something better comes out of this time at least. But that cycle just keeps circling and circling and circling, and all we are left is with hope. Now, for things to change, for laws to be implemented strictly, the issue cannot just remain with the doctor community. She is a fellow Indian, and it is the responsibility of all of us who are not in the medical profession, to stand with the doctors. So I kindly request you to join the fight, because only when the public joins the fight, this does not become just an issue of a community or a fraternity. This becomes a national issue. This is a national issue, and the national issues garner the attention of the right people only when the nation supports. So please join with us in the fight. We have always been there when the nation needed us, and for one single time we ask you people to support us. Come and fight with us. Fight for what is right. Fight for our rights. Fight for safety of women at workplace. Fight for the justice to be served. Fight for the next generation. But most of all, fight for ourselves. Because if we do not fight for ourselves, if this can happen to a doctor, it can happen to women in any profession in future. To prevent that, to provide a safe working environment, it's the least thing that we can do is to stand together in such tough times. Because only when the nation stands together in such times, this becomes a national issue. So please join us. For those of you who can come down to streets with us, march with us, protest with us, that would be really appreciated. Also, we all know the power of social media in this generation. Social media can make or break the nations. So please share about this news. Talk to your colleagues. Very hardly 30 to 40% of India knows about this horrific incident that has happened. Please keep sharing about this incident. Raise your voices. Come up with ideas how safety can be granted at workplaces, at least at hospitals. Hope entire India joins the fight with us.